Okay, so I've been to the ER 4 times now for my eyes. Um, I'm pretty sure this is recording. I might be able to have my dad check it. Like I think through via voice commands, Google can do video recording. Anyways, uh, I went there and I told the doctor, I said I can't take care of myself. And my eyes they just hurt all the time. And I think the tendons around the eye are damaged, mostly on the bottom. I think it happened like when my neck, like my anterior longitudinal ligament was damaged. So, um, so it was burning. I couldn't lean forward or lean backward. Side to side's okay. Echo, stop. Uh, anyway, so I got this thing on to keep my eyes shut, and because my eyes hurt so bad that if I just close them, it's really difficult for me to keep them closed because it hurts. It feels like I got something in my eye, and there's pain, and it's hard to keep your eyes closed when they're like that. At least if it is for me. So then I'm closing my eyes and I'm opening my eyes and closing my eyes open, and this thing just keeps the eyelids closed, and I can just totally relax. Even if I relax or if I flinch or spasm or whatever, they stay closed. And plus, even if they open, it keeps me from looking at things because the problem is focusing on stuff. Because when you focus, it uses your eye muscles, which pulls on the tendons, which are damaged. At least it's very likely, given that I have a long history of connective tissue problems, and every problem in my body is from connective tissue. So there isn't a problem I have that isn't from connective tissue, even the tinnitus, because my C1 squashing my internal jugular veins because the connective tissue is faulty. Anyways, so I've been wearing this most of the day. I did go out for a short bike ride this morning. When I look off like into the distance, it's not bad. Like I don't have much pain. Like so I can look 100 feet away and it feels okay. Like now I'm essentially looking into infinity because my eyes aren't focused. So far away is okay, but anything inside the house I can't look at. So I have to like I was just doing the dishes blindfolded essentially, which is a pain. But not that big of a deal. I know where stuff is in the kitchen. But feeding myself is a huge pain in the ass. Cooking, I can't cook. I can't get food for myself. I can't shop for food, etc. Like I can't go to the store. I can't go online. I can't look at my cell phone. Looking at my cell phone hurt my eyes. The tendons pretty bad when they're already damaged. So just focusing close up is excruciating. Anyway, I went to the hospital and they were just checked my eyes. Eyes are fine. Doctor was like, yeah, given your history, it is probably the tendons, and there's nothing that can be done as long as you have eye movement. When you lose eye movement, then you can do surgery to replace the tendons. But until then the idea is just generally take it easy, um, not use your eyes. But he didn't tell me how to not do that. He just said go to the eye doctor who, you know, it's like I'm like I can't get around. I can't make phone calls. How am I supposed to get to the eye doctor? And then I go to the eye doctor and they don't know what to do. They look at my eyes. They're just like your eyes fine. I'm like I even told them the first time when I was like, uh, it's not my eye. It's around my. It's underneath my eye. It's probably the muscles and tendons. And they're like, okay, and so they decided to do nothing. It's like when someone has tendons and ligament issues and they're in the medical field, like they become retarded. Like they're just like it's just like they can't process in their brain that anything that needs to be done can be done. They just are like, how do I get away from this person and never talk to them and not help them? They don't want anything to do with me if I have soft tissue problems. It's really weird. Physical therapists, obviously, but they like that kind of thing. But they'll help people like me. But um, you know, surgeons, if you have a complete tear, like I was saying, but other than that, you're shit out of luck unless you have money for regenerative therapy. I don't even think they do it in the eyes. Um, so anyway, I'm just hoping to rest because basically, if my tendons don't heal properly, I could get to the point where I could never use my eyes again, and no one will do surgery on them because the tendons still exist, and then I'll just effectively be blind. And the doctors won't give a shit because they don't care. I mean, I've been to the ER 4 times now, and they don't give a shit. They just absolutely do not give a shit. Like every medical professional there, well, they were not concerned in the least that I was. I told them I was like, I can't take care of myself when I go home. What do I do? Like, can I stay here? What do I do? And they just sent me home. They didn't give a shit. They just absolutely did not give a flying fuck. They, like if I died tomorrow, they don't give a fuck. And the people that worked in like the front area of the hospital that had nothing to do with the ER, like they saw me, they took one look at me stumbling around, um, trying to make my way down the hallway, and they were like, "Why the hell are you sending him home? Like, what's wrong with you?" And they were pissed the fuck off, and they went back to the ER, and they took me back in a wheelchair, and they're like, "What are you doing with him?" And so they of course assured her then after that that they were gonna have someone like follow up with me, and they didn't. Nobody followed up with me. Um, so yeah, and then I called Medicaid, and uh, I just signed up for Medicaid last week, I think, and then Molina, which is a company of Medicaid. I don't know what the fuck. Anyway, I called them, and they were like, "Yeah, we could have someone there. Maybe in like takes like 15 days, and the doctor has to like fill out a form and everyone was like telling me go see your, even the doctor, like the doctor at the ER who was checking my eyes told me, hey, you should go see your primary care doctor. And I was like, why? I just looked him in the eye and I said, why? And he's like, he couldn't answer. He's like, couldn't answer me. And he's like, yeah, I don't think that's going to help. And I'm like, looking at him like, what? I didn't say this, but I was thinking, like, well, why the fuck are you saying it? And then I was talking to the people on Medicaid, and they were like, "Yeah, you should contact your primary care doctor about your eyes." And then the people that picked me up in the ambulance were like, have you seen your primary care doctor about this?" I'm like, "About my eyes." Like, are you hearing yourself? Nobody goes to the primary care doctor about their eyes. Because you know what happens? The primary care doctor says, go see the ophthalmologist or whatever. Like, well, why are you coming here? Like, I'm not an eye specialist. Maybe they give you some eye drops for dry eyes, but that's it. So I'm just like, everyone and their sister is saying, go see your primary care doctor. And I'm like, and I've seen primary care doctor like 40 times in the last 3 years, and never once have they helped me. Like, not even one time. Like, not once. So it's like the only thing the primary care doctor knows how to do is, hey, so that'll be $300, and then you go see a specialist. Peace, or that's, I know what the peace sign is. So anyways, I just think that's fucking stupid as shit. And I'm like, I just, people have such high regard for doctors, and I've had family members, I've had friends and other people on the internet like give me shit about like calling medical professionals dog shit retards. And it's like, well, they are. Like, what do you want me to do? Like, when you're a fucking douchebag idiot, when you're a fucking fool, like, what am I supposed to be? Like, oh, no, 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 but they're a doctor, though. It's like, these are not like, it's not like some complicated thing where it's like this doctor couldn't possibly know, and I'm calling him an idiot because he doesn't know something out of their special. It's like, I can toss doctors like the most softball shit, and they can't hit it. It's just, it's just like, and telling me, someone that can barely see, to go to a primary care doctor, it's like, why wouldn't you even just tell me, go see an eye surgeon, someone that's familiar with trauma to the eye and surrounding tissues? or a facial surgeon who deals with that, because some eye surgeons only actually deal with the eye. Some deal with, tendons and muscles around the eye, and that might be like a face surgeon. And oh, I guess what? I know this, having no medical training at all. None. And I got medical professionals who are just like, what do I do? And I'm like, look, man, there's this thing called Google. Like, fucking use it. Yeah, I don't know, like, Jesus Christ. Like, I had, I went to a neurosurgeon and they canceled the appointment on me and just said they couldn't help me. And they didn't even know what was going on with me. They just assumed because I had some x-rays that another doctor took, because Ohio Health's all on the same network. So if one doctor takes images of me and says everything's fine, all the other doctors in the network say everything's fine. Because they're like, oh, this doctor said things are fine, so why would I? But like, so I had a neurosurgeon, an orthopedic one, take a flexion extension x-ray of me and say, look me in the eye. After I told him I had been having instability for uh, 3 years, and I guess really bad in the last year and a half. And and he's like, you don't have good news. You don't have instability. And I was like, well, yeah, I don't have instability in flexion extension. Like I don't. Like I feel strong when I tuck my chin to my chest, and when I put my chin up in the air. Aside from that ALL injury thing, um, and so that's it's not a problem. It's rotating my head and tilting my head. And also, when I sit down, it's different. So, Christ, I'm gonna have to look at the phone to see if it's actually recording and if I'm just talking to the ether. Okay, I'll just do it quickly. Okay, okay, all right. It's actually recording. Ow. Okay, okay, that wasn't too bad. Um, yeah. Ow. Uh, so, anyways, had what was I? Where was I? Neurosurgeon did that, and but like it's like doctors like I will spend the time to make an appointment with a doctor, send him all my imaging, send him my medical background, and say like talk to and in regards to like, hey, maybe I need like a C1 shave or something to do with this internal jugular vein compression, and all this stuff beforehand, and I go talk to him and in person, which is difficult for me, and they're like, I don't know anybody like that. You're gonna have to maybe go to OSU or somebody and see if they know someone like that. And I'm just like, what do you mean you don't know? Like, check the fucking bill. Yeah, I just paid you $350. Like insurance just paid you $350. Um, fucking find out. Like if I do all that, and it's like, dude, I can go on Google in 2 seconds and find out 5 doctors that do it. And this guy's like, I don't know. I don't know a doctor that does that. It's like, bro, like, I have no respect for doctors, absolutely none, because they just constantly get away with walking around and everyone's telling them their whole, like, I've seen it. I've been to a local church where, like, there's this guy and he's going to be a doctor and he's a young guy, and everyone constantly is just fawning over him and telling how amazing he is. And he's not. He's just some fucking idiot. But like, I mean, sure, he's a nice guy, but I'm saying like he's not extra special because he's going to be a doctor. And I think all these doctors are just told a million times, and they're just so fucking special. And on top of that, I've worked jobs where, like, if you work at a job where you can not do anything and just say, oh well, it's hard, and I've seen this in school too, like where you could say, "Oh, it's just hard," and then not do your job, and then people will just nod their head, "Oh yeah, it's hard, yeah." So like for example, if someone says, "Doctor, why aren't you finding out who actually does this?" and like telling your patient this, because you're getting paid for this, and you're spending like 5 minutes with the patient, and then you're not telling him at least who he can go see accurately. And and the doctor will be like, well, medicine's complicated and all this, there's a lot going, and it's like, that's bullshit. It's bullshit. It's not, that part of medicine is not complicated. It's not hard at all to figure out who does what procedures. That is very easy to do and does not take any time. But you see it at like schools where you'll have a teacher who teaches something like foreign language or programming or math, subjects that are considered hard, and a teacher will be dog shit at their job and won't do any work. Um, so, but because they can get away with it, because if anyone complains, if the students are failing, or anything indicates that they're not performing well, like the teachers, then the teacher can just, well, it's hard. And math's hard. If half the students are failing my class every year, well, it's just hard. It's not I'm bad, you know. And so if you have someone who works in a profession where you can say that, most of the time you will get professionals in that field who will say that, who will not do their jobs and will underperform and will just say it's hard because they can just get away with it. Like they think they're these super special badasses and nobody ever questions. If you think a nurse is going to question a doctor, like do you think anyone doing billing is going to question the doctor? Like no, like the doctor is a god. So you do not question them. So nobody they're getting Michael Jackson into stupidity. like like everyone around them is just gives into their fake reality, never holds into any kind of accountability, and then we get this kind of bullshit. So I'm just saying, like the reason why a lot of like people say like our healthcare system this, our healthcare system that, but our doctors are fucking douchebags who don't do their jobs. They're pieces of shit, and they get away with not like if I was a doctor who was helping a patient and he came to me for help and I could do shit for him. I was just like, I got nothing for you. Like I can't do anything. I wouldn't charge them. I wouldn't even. I'd be like, I couldn't help you at all. I'm not gonna charge you. But other doctors will charge you full price and just be like, oh no, good luck. It's like it's the only profession in the world that can do that. I mean, literally, there's no other profession. You can't do that in any other profession. You can't just fucking not do your job at all and then just say, good luck. I'm gonna take this money, and then people will still go to you and give you 5-star reviews and say, oh, he's the best doctor ever. And it's just, I think I don't think it's necessarily the doctor's fault though, because we're the ones telling them constantly that they're perfect, amazing gods among men. And I think so that's why we have shitty doctors, is because we don't say like, I'll give you praise when you actually do some shit. Oh, you're a doctor, big deal, do something. Then you'd have doctors like, oh, I'm gonna fucking do something, because that's what people care about. Like doctors don't really care about patients; they care about like their reputation, their ego, their money, their bank account. Like, and that's everybody. Like most people are like that. I'm like that. I don't care about the people in other countries who are dying in wars. I mean, I say I do, but am I doing anything to help them? Like, am I trying to do? I mean, if I was healthy and like had money and stuff, I wouldn't be doing anything to help. Like most people, I don't care about. Most things I do are just for my sake. Um, so I get it. I'm not like a totally selfless person, but I think it just needs to be said what reality is and why it is that way, instead of like, because I get gaslit a lot by people who are like, who think that doctors are great and can figure out problems and actually will do their jobs. And they won't. And then those people, when they get health problems, they're like, oh shit. Like talk to a young person about doctors and what they think, and then talk to an older person. Old person will be like, they fucking suck. I, but a young person will be like, oh, they're great. Doctors are the best, and they do all this stuff. It's like because old people have problems and have to go deal with the doctors, and then they're like, oh, yeah, they're shitty people. But some doctors are great, like Dr. Larry Lowe. Oh, fuck. Uh, Dr. Larry Lowe over at Northwell Health. I mean, he's great bedside manner. He's really intelligent, puts his ego aside, and is just tries to figure out shit out. Tries to help people. I mean, he's a good doctor. And Dr. Patsalides, I saw there, he's a good doctor. I mean, there's good, hardworking people too. Like even in those fields where you can get away with being shitty, there will still be people who do well and are good employees and do their job and are really dedicated and like bust their ass. So that they exist too. I'm just saying, I just both people exist, you know. And I get all these like EMTs and all these people saying, "Go see your primary care doctor. Go see your primary care doctor." And it's like, dude, they're not a god. Like they're just it's some douche who's like, "Go see a specialist." Like, and it gets paid for it. It's the easiest job ever. Like, and you could, like I was saying, you could be a good doctor and a primary care doctor, but most of them phone it in, and you know you could be the first appointment of the day and you're still going to wait 45 minutes to see the doctor. You know, it's just like, what the fuck, man? Like, anyway. All right, gonna try to stop the video.